What's up, you guys? This is your boy Miguel giving you your daily dose of radiation. In today's video, we're covering top most challenging situations you can find yourself as an X-ray tech in the ER, or just an X-ray in general. But that's what I'm covering. So, to give you some credentials, I am an X-ray tech. Been doing it for 4 years, night shift duty. And I work a lot of overtime, so I do work a lot of day shift and night shift. It's the most intense situations I find myself in, as far as it's not like life threatening or anything like that, but it's more of a kind of like show your skills. You only get one shot type of deal, life or death minutes type situation. Is, let's say a patient comes in level 1 to your hospital, got shot in the chest, right? He's in the stretcher, trauma bed, got all the nurses, got respiratory, got the doctor, got the whole shebang, They're in there doing their thing. And they're like, Psh, X-ray, come up in here. We need you to shoot a chest X-ray. You're like, all right. You pull up. Homeboy starts coding. They're doing compressions. You're like, somehow sneak in there, put your port under. They stop. You have literally one shot for everyone to stop compressions for like a few seconds and for you to get that shot. And maybe that's literally the only X-ray you'll get. And if, God forbid, you clip it bad, or like it's like really, really bad, sometimes that's literally all you get, because like homeboy gotta go. Like he gotta go to surgery, he gotta go. Like sometimes those are like the most, to me, the most nerving type of skills. But I ain't gonna lie, if you get it on the first shot and it's texture, you feel like the man. I'll tell you that. You feel like a gangster. That's like some of the more nerve-ish, like I call it the money shot with my partner. One of the nervous situations that you'll kind of find yourself in. Another one is like if the patient is very hostile and aggressive, and you're trying to get a chest X-ray or trying to get something like that, and like he's moving and he's like, and you're just kind of like rotoring and just trying to time it to where you can kind of shoot it where he's in the right position. Those are the more, like, that's another challenging situation you can find yourself in, but it's not as life threatening as like the first one. Another one would be like little kids, but it's not. It's more of like a challenge, because certain kids, they don't really hold still. They're squirming, they're moving, they're afraid, and it's kind of like timing the situation. That's not really like, you don't feel the pressure as much. It's just kind of like you'll feel bad if you clip it, if you got to redo it, and like your partner's holding type of situation. But I would say the first one is still one of the most intense ones, because there's times where like they'll be coding and you'll be there waiting, like literally waiting, like with the button in your hand, everyone like trying to work around, trying to like find that second, that moment, because like sometimes everyone, like for certain situations, it's like maybe the ICU, or like it's a tight space and like people can't leave because the patient's not good, and you'll have to radiate certain people. So if you gotta go again and again, people are probably like, yo, I'm getting lit up here, and like you're kind of, not doing a good job type of situation. So it's kind of like those few moments you kind of like, it's kind of like a tricky, challenging situation if you're not as confident with your skills, or your angles off, or certain stuff like that. It kind of tests your X-ray skills, I feel, a lot. And with time, like the nerves, I don't get nervous as far as my positioning or not. I'll be just more, did I get, like, I'm just trying to get like more optimal pictures for the doctor. And mine, like it's more of a technique is where I'm at, because sometimes you'll shoot it perfect, everything, and then your technique will be off. And if it's really bad, you may like burn it, and then you'll have to reshoot it. So it's like, sometimes you can save it, sometimes you can't. So yeah. It's been your boy Miguel. See you on the next one.